Okay guys, so in this video we're going to go through a quick couple of techniques that you can use for cervical spine mobility. The first thing we're going to do is test whether that is an issue. So Patrick, you come to the middle for us. So we're just going to have a look first, chin down to chest, looking up at the ceiling, back to the middle, turning to your left as far as you can go, and turning to your right as far as you can go. Back, perfect, and then left ear to left shoulder. And right ear to right shoulder. Again, obviously, normally I would do this from behind. And you're looking for how much has he got in each of the ranges of motion. Is there any restrictions through there? And do you think that's something you need to work on? If it is, there's a couple of techniques which I quite like for this area. So the first thing we're going to do is a little bit of lacrosse ball work. So again, you can use tennis balls for this. But I've got lacrosse balls here, they're a bit firmer, so I'd maybe start someone with tennis balls and work on up to lacrosse balls. We're going to work the thoracic spine first. So thoracic spine being stiff often inhibits that cervical spine. So if we come down to your back, Patrick, so again, like we did in the thoracic spine video, we're going to come onto the lacrosse balls, head down towards the floor, and then we're going to go with the hands across your chest, and then just extending, so coming up, and then extending back over the balls, using the elbows to, and then back down again. That's good. So we're extending over those lacrosse balls. You can do that as well, straight arms. So if we go straight arms, Patrick, straight arms over the top. So you can do it like that as well. So two ways to work on that thoracic extension. And then you can also, hands around the body, go left to right. So a little bit left, a little bit right. Again, we're on one section of the thoracic spine, and then what we would do is move the peanut further down the spine between that kind of upper sort of T1, 2, and then down to about T7 around the shoulder blade region. I generally don't go that much lower than that for the thoracic, but you can if you want to, but I generally would stick in that area. Then what we're going to do is actually work on our occipital region. So I find around here gets quite glued and stuck with a lot of people. So what I'm going to get Patrick to do, again, just under that occipital region, then go down towards the floor. I personally find it's much better with the peanut than with the single ball. Holding onto the peanut, just so that you've got some stability through there, and then he's just going to do a deep neck flexor, or tucking the chin in towards him, making a double chin, essentially, is a cue that you can always use with patients, and that generally will increase the pressure through that occipital region. Then if we do that, hold that position, and just rotating left and right. So again, just really like this for releasing around this occipital region. Just seems to be an area that picks up a lot of tension. And again, in terms of all those neck muscles that come up and attach into there as well, it's helpful to release that off and then relax. Then the other one I use a lot is levator scap. So what we're going to do is we're going to pop the ball into that levator scap region. A lot of people will find that, and again, if you come down, Patrick, you can move around to find that spot that's good for you. A lot of people will find that this is a spot they always talk about, kind of trying to press, and it really feels quite sore. So I really like this one. And then hands over the top. As you bring the hands over, you get a bigger release of that muscle, or a bigger or more pressure through that area. Like we've talked about in the other videos, exactly what you're doing from a mechanism point of view is still a little bit unclear. You're probably not having any massive effect on the actual structure. But what you are doing, again, I find a lot of the time, is desensitizing potentially the nervous system in that area, which means that movement is better, and if movement is better, again, usually pain is less. So I use these techniques, even though there's not a massive amount of evidence to say exactly what physiological mechanism they are influencing. Cool. So then what we're going to do is, if we go into our neck, just simple neck range of motion exercises. So if we come into sitting, Patrick, first thing we can do after doing those release exercises is a bit of what we call P&F stretching. So if I get you to rotate to your right, Patrick, bring your hand onto your chin, and then what we're going to do is just very gently, about 30% of your maximum, you're going to turn back to the left into your hand, and you're just going to hold that for about 5 seconds, then relax, big breath out, and then just try and take the neck a little bit further round. Okay, then stop where you feel that restriction is. Then do that same thing again. So it's a contract, relax technique to just improve that rotation over to the right and left. Again, you want to be careful with this and just go as far as you feel you can, but can be really, really effective. And then relax. Perfect. And then we're going to do our levator scap stretch. So this one, we're going to anchor the hand. We're going to bring the other hand over the head. and then we're going to stretch down and across. Okay, so we're anchoring that hand so the shoulder blade stays where it is. We're getting essentially a lateral flexion rotation away, so we're stretching that levator scap on that right hand side. Perfect. And then upper trap stretch, so again hand over the head, and this time it's going to be a much more of just a lateral flexion stretch. And now again we're getting into these muscles here, or upper traps, a little bit more. So again, what we're going to help with that is our lateral flexion. We've done our PNF to help our rotation. The thoracic extensions and the lacrosse ball work should help with our flexion and our extension. So again, simple little techniques you can use to improve someone's neck and cervical spine mobility.